Assalamu alaikum. So today we have an article about the deep margin elevation, which is a technique to relocate the subgingival margin to ecogingival or supragingival margin. And this technique considered as non-invasive, comparing to crown lengthening, surgical or orthodontic extrusion, and it's facilitate the impression taking and the crown cementation. And this technique considered as a valuable technique in endodontically treated teeth as the majority of the teeth that we encounter in our practice have deep margins. So today's article have a title of Clinical and Radiographical Evaluation of CAD-CAM crowns with and without deep margin elevation, 10-year result. It was published in the Journal of Prosthetic Industry by Ahmed Aziz in 2024. So the aim of this study is to assess the clinical performance and periodontal health of teeth that receive lithium disilicate crowns with and without the margin elevation. They collected patient info from 7 private practices and they included the patient indicated for a crown with and without the margin elevation. And they excluded patients with poor oral hygiene or an active periodontal disease. And the treatment was performed by an experienced prosthodontist. So for the sample size, they included 380 patients, which have 426 teeth that receive crowns. And there are two groups in this article. The first group, the deep margin elevation group, which has 157 teeth, and the group without the deep marginal technique, which has 273 teeth. Bite wing and BA were taken to assess the marginal bone loss, and they clinically assessed the clinical attachment loss, bleeding upon probing, and the presence of a plaque around the teeth. And they used the contralateral tooth as a control group. They measured at 3 periods. The first one immediately after the crown placement, the second one at 60-month period, and the third one at 120-month period. So the results the included patient has a follow-up period of 10 years, and no significant finding was found in clinical attachment loss between the two groups. However, there is significant difference comparing to the control group. Regarding the bleeding and bone probing, plaque index and the marginal bone loss, there was no significant difference comparing to all groups. The success rate was 95.8% and 94.7% for the deep marginal elevation and the group without the deep marginal elevation, respectively. And they concluded that the deep marginal elevation do not negatively affect the periodontal condition of the teeth. So my opinion about this article, it has a good sample size with an excellent follow-up period, which is 10 years. And they collected the info from 7 private practices, which also good for the generalizability of these results. However, this article is retrospective in nature, and the deep margin elevation was performed by an experienced prosthodontist, which may lead to change in the outcome if it is produced or performed by a less experienced clinician. And it was also mentioned by this article and many other articles that if we cannot achieve a perfect seal with the matrix while doing a deep margin elevation, the technique is contraindicated for the tooth. And thank you for listening.